This is Brett Taylor, dentist and author of the Getting Your Smile Right book, and this is another in a series of short videos to explain how to communicate better with your patients using the book. This particular video makes me look like an idiot, but I think it's worth telling this story to make a point. This is Chris. He's a good mate of mine. He's not so pale in real life. Chris and I met in 1985. He was a staff specialist anaesthetist and I was a 24-year-old dentist about to be chopped open to have a heart defect corrected, and Chris was the man who was keeping me alive, bless him. He ended up marrying a uni friend of mine who was watching the operation, and we've been mates ever since. He likes to point out that I'm a living example of his good work, and his wife likes to point out that she didn't peak when they turned my body over in the operating theatre. Anyway, Chris has been a patient for maybe 20 years, and like patients that you've seen for a long time, you tend to take them for granted, and I tend to take Chris for granted. I'd see him socially, I'd see his teeth. This was just Chris. And it's not the world's greatest smile, but when you've known someone a long time, you just sort of take them for granted. This is how he looks in his smile shot, and this is how he looks when he snarls at you. There you go. You can see that he's got full lip movement here, but in this photo of his smile, there's an affectation, like he's trying to hide something. Same over here. He's had surgery on his neck, which affected his lower lip on the right side, but didn't affect his upper lip on the right side. So something's going on here. Anyway, this story is basically about you don't know what you don't know. I gave Chris a pre-production copy of the book, and he stuck it in a drawer, went away on holidays, came back, read it, and rang me up and said, "Mate, I read your book. It's fabulous," bless him. And that's me. All those things are me. I'm the guy that doesn't like having his photo taken. I'm the guy who's ashamed of his teeth. I want to be fixed up. When can we start? You've probably got patients like Chris in your practice. People who you've taken for granted, people who you might have mentioned years ago that they could fix their teeth and they didn't seem real interested and you didn't really follow on with it. But Chris is, someone who, because he saw the book, read what was in it, he's decided that he wants to go ahead with treatment. So the message is, if you don't show it to people, you won't find out who wants this sort of work done. I didn't think that Chris was a candidate because he'd never mentioned it and he had plenty of opportunity to mention it. But there was a lot of stuff lurking there that I really wasn't aware of. And yeah, sure, I'm an idiot for not teasing it out of him. But thankfully, having read the Getting Your Smile Right book, he's come to the conclusion that he wants this treatment, and I know he's going to be very happy with it. And I'm hoping to be able to show you photos of Chris's after case in the coming months. So the message is, buy the book. That's always the message. But use it too. Get it out there. Give it to people who you don't think will want the treatment. Just have it lying around in your waiting room so that people can have a look at it. Or give it to unsuspecting people, or give it to old friends or old patients. It's not just for new patients. You won't know what people want until they read it and identify with the people and the stories. That's seems to be, from the early users and from my use of it, the main advantage. People don't know what they want, but once they start looking at other people, seeing what's possible, hearing the stories or reading the stories about other patients, they come to the conclusion it's what they want. So go out there, buy it, give it away, enjoy your life.